My name is Marc Jaffe, and I am the CEO of Children's Learning Centers of Fairfield County, CLC. Thank you for this opportunity to testify today on SB2. I run the largest nonprofit early childhood education center-based program solely focused on early childhood education in Connecticut. We serve 923 children ages 0 to 5 in 8 centers in Stamford. We have 220 employees, enabling 1,600 parents to work. We have a 9-figure economic annual impact. A high-quality early childhood program critically includes social and emotional development. Addressing mental health issues for children ages 0 to 5 is far more effective and far less expensive than any time thereafter, and we're doing it as we speak. Partnering 10 years ago with Yale Center for Emotional Intelligence, we created the Pre-K Ruler program, and now in a groundbreaking partnership with Columbia Medical School's Nurture Science program, we're focusing on emotional connection between a parent, mother, and her child, resulting in dramatically improved children's behavior and less depressed mothers. Our study had statistically significant results with large effect size. Now in COVID, doing the work virtually, which if successful, may allow an inexpensive and scalable model. The problem is our industry is on the verge of collapsing, so may not be around to continue this work. And let's talk hard numbers, our economic reality. It costs us about $16,500 per year per student in our school readiness program, which critically is 51 weeks a year, 10 hours a day. By 2023, that $16,500 will increase to about $19,000. The driver minimum wage increase, which we support. It was $9.15 an hour in 2015, and by next year, $15 an hour, a 60% increase in 8 years. Our largest revenue stream is our per-child reimbursement, which was $8,900 in 2015, and in 2022, still $8,900. So unfunded mandate, wage compression, no ability to hire talent. There are over 1,300 job postings on Indeed for early childhood educators. Now, we have multiple revenue streams, but they total about $14,000 a child, which leaves a $2,500 per child deficit. It means that we have to raise annually over $2 million a year in the private sector to break even. Next year, over $4 million, and we can't do it. Now, I know you have lots of
Mr. Jaffe, but your time is almost up. If you please summarize. Thank you.
I know you have lots of calls on your capital. The ROI on ECE is better than any other ed program, 13% per annum. Now, Representative Sanchez is introducing a bill for $700 million. It's part of a multi-year $2.5 billion ask. My ask is merely $55 million. We need the per student reimbursement increased to $14,500. Now, it clearly doesn't address the overall and larger systemic underfunding, but does plug an immediate hole. The consequences for not responding to this industry crisis is its implosion, tens of thousands of folks unemployed, 100,000 plus parents withdrawing from the workforce, and Connecticut plunged into a recession. And I thank you, and I appreciate your service and your listening.
Thank you for your very candid, if blunt, warning to us that we better get it together. Rarely have I heard 55 million referred to as merely, but I guess it's all relative in the scheme of things. I know we would benefit if you could provide us with the data that supports your ROI argument. I think it'd be very helpful for us. To your point, the earlier we're able to intervene effectively with children, the more we save in the long term. So we take your point, and you're certainly telling us a story that we've heard often enough from nonprofits that they're struggling right now. So we take that very seriously. Senator Anwar has a question for you.
Thank you so much, Mr. Chair. Thank you, Mr. Jaffe, for your testimony and working on the SB2, we recognize the fact that this industry is truly at the brink of a collapse. And this is one of the first building blocks for our economy. If the parents of young children are unable to work because they are unable to get the childcare, because the childcare centers are just going out of business left and right, they will not be able to work and be a part of our economic opportunity. So we are hoping to have some emergency grants. We are going to work with the Office of Early Childhood to be able to address for the wage support. The federal government and the Build Back Better did not happen. That was going to be a very critical piece, but in the absence of that, we need a immediate support like yesterday to save as many of these as we can. And we are hoping that we will be able to get appropriation for this as well, because this will require funding. And I truly appreciate your testimony and look forward to getting some more numbers like Chairman Steinberg had suggested as well. We appreciate your testimony.
Well, thank you, Senator, and we appreciate your support.
Next up, we have Representative Kavros DeGraw, followed by Representative Comey.
Thank you, Chairman Steinberg. And Mr. Jaffe, great to see you. Thank you so much. I appreciate that you're here today testifying, and I certainly echo Dr. Anwar's concerns. I was wondering if you could just tell us, briefly, some of the interventions that you're talking about that you do in terms of children's mental health under 5, because I'm not sure people are aware of the types of things that you are engaging these kids with.
Well, so there really are several. I alluded to work that we did starting 10 years ago with Yale Center for Emotional Intelligence, and they have a tremendous program, which I'm sure you're familiar with, called Ruler, and that was targeting K through 12, and we adapted it with them for pre-K children, and it's embedded in our curriculum. All of our staff are trained in it, and it really does help both teachers and children to recognize, understand, and label their emotional state. The work we're doing more recently with Columbia Medical School is hugely exciting, because that's actually not cognitive based. It's based on the autonomic nervous system, our biology, and the gut. And it's 2-generational. And so the results that we have seen are children through calming sessions, their behavior becoming significantly improved, and the mothers are becoming less depressed. So we think that that's a very exciting work. And then I would say in general, and again, we're a large center, we actually have nurses and family social workers on staff. And so we can intervene early on when we see dysregulated behavior. We can work with fellow agencies to refer for children who are more challenged in that regard.
Thank you so much, because it's so critically important that we are addressing this, as you said, as young as possible, because it really does lead to better outcomes and the more focus that we have on that. So, when I think about your CLC centers and others like them, I mean, it's not just what's going to happen to our economy if we don't have these child care centers, if people are unable to work, but it's also the direct point that you just made in terms of making sure that when dysregulated behavior is seen, that it's addressed at an early age. So thank you so much for your testimony today.
You're very welcome. Thank you.
Thank you, Representative. Representative Comey.
Yes. Hello, Mark, and thank you so much, Chairman. I was wondering, I want to thank you for your candid description of what's going on in the marketplace. And, we've never appreciated the situation more than we have now. I'm wondering if you could share, I believe it was Representative Steinberg who discussed that grant funding would be available for some of the needs. Can you discuss a little bit about what happens with grant assistance when you receive it from the state, as far as timing and specifically meeting the long-term needs of, the sustainability of your programs and how that impacts directly?
Yeah, well, and first I'd like to say, and I think Senator Anwar referenced Build Back Better, and I think we were all excited about that, and I think we were all, in some ways, dependent upon it, and now we obviously have to readjust, because even if the child care portion of Build Back Better passes, I will tell you it is likely to be too late to help many programs that are really now on the ropes. So now, again, we're a large center. We were supported by a PPP, and I think you may know some of this. 63% of programs in the state are running at a deficit. So they're gonna sink very soon. And 89% of programs have classrooms that are closed because they don't have sufficient staff. So when we see increase in funding, I mean, it basically goes to teachers' salaries, and it goes directly to programs. In the state, I believe the average teacher's salary is $26,000 a year. Now, again, in my bluntness, right, the person who takes out my garbage gets paid more than this teacher, who, again, unlike public school teachers, they're 51 weeks a year. So, we're talking about living wages, and the wage compression that we're seeing really is dramatic. We can't compete with Amazon, who's paying a college graduate $19 an hour and a $3,000 bonus. And so there's a rippling effect from systemic underfunding. I'm not sure if I directly answered your question, but.
Okay, thank you.
Thank you, Representative. Senator Kushner.
I'll be brief, but I really do appreciate your testimony here today, Mark. I'm very familiar with the teachers, as you know, at your center. I've known them for 20 plus years, and the work that is being done in Stanford is wonderful and is so important. And so, but it is extremely alarming to know that all of this is in jeopardy. So I just wanted to give a shout out to you and the work that your teachers are doing.
Thank you. Thank you. Yeah. And by the way, kudos, because they are heroes. COVID hit in March and we reopened in April because the largest employer of our parents is Stanford Hospital. And so nurses couldn't go back to work if their children didn't have childcare. And so we opened in April, and we've been open ever since.
Thank you for that. Thank you, Mr. Chairman.
Thank you, Senator. And again, thank you for your testimony, and particularly your candor. We need to hear the urgency of the circumstances if we're going to devote the adequate resources. So again, thank you.